Hi, this is Robert with Brave Defender Training Group. I want to take a minute out of your time today and I want to discuss a method of bleeding control that we can use during tactical medical environments to control life-threatening arterial bleeding. And that's a technique known as wound packing. Now, wound packing is a very effective form of controlling bleeding, but it's important that we understand when to appropriately utilize this. This form of bleeding control is going to be best utilized during the indirect threat care phase of the TECC environment. This second phase of care is very specific because the threat has been reduced. In the initial phase of care, direct threat care, because of the ongoing possible hostile nature of that phase, we want to make sure that the only form of bleeding control that we are using is that of a tourniquet. Anything else would just simply be too attention focused and require too much hands-on in order to be able to focus on the threat as well. So we're going to focus on wound packing during the second phase of care. Now, wound packing is ideally suited for a scenario where our tourniquet may not be feasible. This could be a situation where the wound is either located too high on the extremity where I cannot effectively get the tourniquet above it to be able to control the bleeding, or it could possibly be located in what we call a junctional area, such as our armpit or our groin, where I can't get a tourniquet into that region. There may also be circumstances where if we have multiple casualties, we may not have enough tourniquets for all of the wounds that we're trying to deal with. Especially in mass casualty events, tourniquets are going to run out very quickly. And so wound packing gives us another method of controlling arterial bleeding when we don't have enough tourniquets for that scenario. Wound packing can also be utilized on non-life-threatening bleeds as well. Rather than waste a tourniquet on a non-critical bleed, we can use wound packing on non-life-threatening venous bleeds once we've handled all of our priority wounds as an effective method of controlling that bleeding. Now, historically, when we've talked about wound packing, we've referred to it or commonly associated it with hemostatic or clotting agents such as the combat gauze or quick clot. However, wound packing can be done even with conventional gauze, such as this one right here, that is commonly found in most medical kits, which is just a compressed Z-Pack gauze, or even just a conventional rolled gauze like this right here. The technique is going to be the same, whether you're using a conventional gauze like these two, or if you're using the hemostatic clotting gauze that is oftentimes found in higher-end medical kits. Now, there's several techniques as to how to do a wound pack. I'm going to show you today one of those techniques that is a two-handed technique, and in my opinion, it's one of the simplest and easiest ways to do it and still maintain good effective control over the bleeding. So when I do my wound packing, one of the things that I want to do is, if possible, I'm going to use manual pressure to control the bleeding and slow it down in order to give me time to get my equipment out and get set up. Another thing that, if the situation allows, I may go ahead and cut the clothing away from the wound site so that I can view the extent of the injury that I'm dealing with and I know exactly the size of the wound that I'm dealing. Once I've done those things, that allows me to visualize my wound and it'll give me an idea of exactly how I'm going to be able to pack this wound. Now, for today's example, I've gone ahead and I've already opened up my package of gauze that I'm going to be utilizing. Once I have that pack opened up, I'm going to go ahead and I'm going to take the end of that gauze and I'm going to get a bite of it around my finger. Now, the size of the wound channel is going to dictate as to how many fingers you're going to need to use in order to do this wound packing. On our wound cube simulator that we have here today, based on the size of this wound, I'm probably only going to need about one finger in order to get in and compact this wound site. So what I'm going to do is I'm just simply going to get a bite of that gauze around that finger, and then I'm going to go ahead and slide that into that wound channel. Now, as I apply pressure into the wound channel, I'm going to apply pressure towards the heart. So if this was my arm and it was traveling up towards the shoulder, I would apply my pressure upward because I'm trying to locate and find that artery that may have retracted deeper into the arm. So as I apply that pressure, I get it all the way in, getting it as deep as I can get it inside of the wound channel until I find the end of that damaged vessel. I'll be able to feel the blood spurting off of that artery, and that's what I'm going to try and compress. Using that gauze, I'm going to try and pinch that artery closed and start restricting the bleeding. Once I've located that damaged vessel and I've compressed it, I'm going to hold that finger in place, and I'm just going to simply come up with my other hand, get another bite of gauze, and simply come across the top of the first and swap those fingers out. And I'm going to continue repeating this process, just simply swapping fingers out, grabbing a new bite of gauze, and coming in on the top of the other finger, packing up towards the heart. Now it's going to take several times for me to do this as I fill this wound channel up, but eventually I need to make sure that I completely fill this entire void. So as I'm filling this, that means I might need to be packing around. I want to fill every void and every cavity in here because I don't want to create an opening for this wound pack to shift during any transport. So I'm going to fill this entire wound channel up as much as I can possibly get it, and this may take, depending on the size of the wound channel, a significant amount of gauze. Now once I've gotten to the point where I can't pack this wound channel anymore, I'm going to take what left I have of the gauze. This is what we call a power ball technique. You'll notice I'm leaving my finger in place, maintaining pressure on that wound. I'm simply going to take this gauze, ball it up as tight as I can get it, and then simply swap that out. So now I'm delivering direct pressure through that tight power ball, through my tight wound pack, and onto that damaged vessel. This is what is controlling and restricting that bleeding. So my wound pack is effectively finished. However, what I want to do now is be able to free my hand up so that I can move on and continue treating other injuries or other patients. So at this point, I can go ahead and take some sort of pressure dressing or pressure wrap, such as this one right here that I've already opened up, and I can simply slide it over the top and swap my hands out and continue delivering pressure. Now, I'm just simply going to wrap this injury up as tight as I can get it, and just wrap this limb up using this pressure dressing. And once I have that limb completely wrapped up and secured as tight as I can possibly get it, I'll simply just go ahead and secure and lock this pressure dressing in place to hold my wound pack for me while I move on and treat other issues. So now I've effectively secured my wound packing with my pressure dressing. So now this allows me to go on and continue treating other injuries. Now there is a slight difference if I'm using conventional gauze or if I'm using hemostatic gauze at this point. At some point this gauze may get soaked through if I'm sitting on this patient for an extended period of time. If I'm using hemostatic gauze or the clotting gauze, I need to remove that gauze once it gets soaked through and insert fresh gauze because I need to get more of that agent inside of that wound to continue promoting clotting. If I'm using a conventional gauze, such as what we did here today, I'm going to leave that soaked gauze in place because clots have already started to form on that gauze. I don't want to rip that out and tear out all of those good clots that are already starting to do work. So I would just grab fresh gauze and continue to pack on top of that and secure it in place. But that's the only primary difference between a clotting agent gauze, such as the Quick Clot Combat Gauze, or just a regular conventional gauze, is what you're going to do if the gauze gets soaked through. Now, as you've seen, this is a hands-on process, and that's why we do this during the second phase of care. This is also something that the first time that you do it should not be in a real-world application. So I encourage everybody to go out and seek additional training in how to effectively perform a wound packing so that you're experienced in how to do it so that you're able to do this correctly in a real-world encounter. If there's anything that we can do for you, please don't hesitate to contact us. Thank you.